Okay, Elazar, this is your second attempt. Let's just see how you do here. Just get my annotation going here. Okay, so you started off with a title. Okay, so what does the task say? Who are you writing to? Yeah, you are writing to medical students. Okay, so let's just see where it says medical students here in the first paragraph. Okay, there are some terms, there's a grammar mistake, difficult to define, such as health and normality. The definition of health, according to the WHO, is not only freedom from disease and abnormality. Okay, I'm not sure I understand that part. So it's freedom of disease and normality? Is that what you're saying? Not sure. Also, is soundness of the body and mind. Okay, so it is also, yeah, because you're defining it would be a healthy, the definition of health, okay? The previous definition changed view about health and illness. Okay, I think you're focusing too much here on the definition of health rather than the clinical iceberg, which is what you were supposed to, that was the task, right? Describing clinical iceberg to medical students. Okay. Iceberg is a medical concept. Actually, no. Iceberg is not a medical concept. Iceberg is a metaphor to explain, the clinical iceberg, yeah? It's a concept used to describe graduation of health and illness. Okay, that's good that you're using graduation here. You're using a synonym here to describe the different degrees of health. But we don't use graduation in this way. Yeah, so what you want to say is iceberg is a medical concept. Okay, clinical iceberg is a medical concept that is used to describe the differences between health and illness among people. That's what I would say, maybe. In the clinical iceberg, there are, remember the to be verb, 6 degrees, okay? 6 levels, maybe? Statistics distribute people over this. How many degrees are there? Is this plural? Yeah? Right? So what do we use when we have a plural here? Yeah? Over these degrees or over these levels, okay? And most doctors can't say the correct observation to the patient. I'm not sure if this is observation. I don't know how to correct this. And most doctors can't, I'm not sure exactly what you're trying to say in this section here. Yeah. They only see a visible part of the iceberg. Okay, so you're supposed to be explaining this to medical students, remember. So I don't see that part of the task here. They only see the visible part of the iceberg. The majority of people are classified as healthy. The second group are considered to be normal, but they have some characteristics. Okay, you're not really explaining what the iceberg is here. Yeah, you need to remember that we don't understand what you're talking about. Yeah, you have to describe it right from scratch. Characteristics like obesity, which may develop and lead to disease. Another group in pathological conditions where there are no visual signs, while another group have no apparent signs, but the diagnosis detect the disease. Okay, not a further. I think you're using the wrong connector here. People with obvious signs and symptoms are in, again, the to be verb, yeah? You seem to have an issue with the to be verb here. Are in the visible group of part of the iceberg who go to the hospital. And the top tier are those that are dying or people seriously ill. Good. Okay, you didn't conclude and you have a definition as your introduction, but you need to introduce the topic of the clinical iceberg, not the definition, okay? So we have some improvement to do with the task, I'm afraid. So good try on your second effort. Okay, a little bit better. And we'll see how we do on the next one. Okay, let's see how you do on differential diagnosis.